So this is the first official Grantee Learning Collaborative for the 23 to 25 grants. This is an effort that we hosted for the 21 to 23 grants. And we got really positive feedback about it. So we decided to get it going again. So we hope that this is a useful space for all of you to connect really around anything and everything related to your system of care grants. So it is a condition of the grant agreement that you attend. If you can't make it, you can find somebody else from your system of care, your agency or organization to step in. We are recording it, so worst case scenario, really nobody can make it. The recording would be available. And they're only being held quarterly. I think the last round they were like every other month. So we dropped it to quarterly. So hopefully this feels manageable and also like a good use of time and support for you all. So today I've got just a few kind of like updates about the grants and really want to address any questions or concerns you all have about those grants as they are quickly becoming signed and invoiced and all of that. So that's really exciting to see them kind of actually get out the door. And then thought we would use the space to let you all share with each other a little bit about the work that you're doing within your grants. We could do that in a breakout if we get more people. If not, maybe we can just do that in the room. And then would like to wrap it up with a discussion and hearing from you all how you would like to use these collaboratives moving forward. So that's a little bit about the plan for today. Do we need to do introductions? I feel like, except for Laura. Are you new to this space? Forgive me, your name is not.
No, yeah. Hi, everybody. My name's Laura Moran, and I'm sitting in for Heather Pasco, actually, because they're on a trip right now, and she wasn't going to be able to make it. So she just asked me to sit in and listen and fill her in on whatever comes up. So hi, everybody.
Great. Wonderful. Thanks for being here. Okay. Well, I do have just like a few slides just to kind of help my brain. Let me pull these up. So just a couple reminders about the requirements of these grants. One is that you can submit your invoice upon final signature. So as I get a copy of that final signature, I'm trying to remind you like, okay, everybody signed, go ahead and invoice. I might have forgotten somebody along the way. So if you feel like your grant has been signed and you haven't gotten an invoice, or haven't gotten an email, anyways, send your invoice as soon as it's signed. And we will get your money to you. I heard it's taking anywhere from like 7 to 10 business days to transfer that funding over. If it takes longer than that, please let me know. Once I pass along the invoice to the finance team, I kind of lose track of it. So if it gets stuck, I'm happy to help find out what's going on there. We are still on a quarterly reporting. The dates are here. So the first one will be due end of July, reporting on kind of, anything from start of the grant through June 30th. The reporting template is attached to the calendar appointment. So if you haven't looked at it yet, I encourage you to do so. While the template has changed a little bit in terms of like the order of questions and the way the questions are maybe asked, like fundamentally the information isn't terribly different. But if you have questions about what we're looking for in those reports, please do let me know. Let's talk about that today. The other change I wanted to let you know in terms of the reporting is that the SOC Grants Committee is going to start kind of collectively reviewing the information you send in. Historically, it was just me, which was great for me. I love to read kind of all the great work that's going on. And then, I would follow up here and there if we had a question or a concern about something. But the whole grants committee was really missing an opportunity to learn about the great work that you're doing and better understand the types of things that you're investing in your community. So When those reports come in, we're going to divide them up among members of the grants committee. We've got a little kind of quick form that people are going to fill out kind of in response to those reports. It's really simple. It's things like, what do they want to celebrate about your youth and family engagement work? And what do they want to uplift about your DEI work? And so, anyways, the intent is that we would kind of get some of that feedback and actually get it back to you. So again, kind of getting a bit of a feedback loop about what you're sending in those reports. I think that's all I wanted to say. Selby, I see your hand raised.
Yeah, I had a question about the final report.
Mm.
So I noticed, so the quarterly reporting, the final date is July of 2025, but I think the contracts run through December.
Yes.
And
yes.
so I just kind of wondered, like, and I'm sure that's just in case we need the time or run out the final bit of money. But then I was like, do you want a report in what would effectively be 2026, like January or March or something? So I just kind of wondered about that 6-month time difference between those two deadlines.
Yeah, great question and observation. Yes, all of those things are true. So what I learned from my contracts person is that the end date on those grants has to come after all of the final reporting has been completed. So that was kind of the first reason. Okay, well then why isn't it August 1st as the end date? And that is because in the event that we have to extend these grants or it's taking you a little bit longer, I didn't want to have to like be bothered by processing all of these amendments. So you've got kind of a 6-month wiggle room there. In the event that you really, that you do kind of have lingering activities in the second half of 2025, we'll probably do what we're doing now, which is to ask you to report out on any activities in the second half of 2025 and whatever new reporting we set up for the next round of grants. Does that make sense?
Yeah, no, thank you. And before I forget, I also wanted to say out loud, thank you so much for the fast processing of this. I couldn't believe that we got the contracts in April, and I just think that was huge. And I know you worked hard to push those through and probably heard a lot of complaints about the delays in the process in previous rounds, which was, probably just due to lack of staffing at SOCAC, but now you're well staffed. And anyway, just really appreciated so much how fast those were processed, and that my funding gap has really just will have been very minimal. It was a funding gap I was able to anticipate and build in, and get some support from other budgets at HealthShare to kind of cover if I had minor expenses between like January and when the contract signed. So really appreciated the reliability and how soon they came out.
Great. Thank you, Selby. Any other questions about the reporting? We're on it. I guess the only other thing I wanted to add about it, and this goes back to kind of this new feedback process that we're implementing through the grants committee, is that you are all very encouraged and invited to attend the grants committee and be a part of that committee. Selby, I think actually it was you who suggested in that committee like a year ago, like, oh, wouldn't it be great to do a little bit of like a peer review kind of process on like what other people are doing and just what we can learn through really kind of digging into the weeds a little bit of other people's grants. And part of this process of asking the grants committee to look into those reports is that that process, right? Because we do have SOCAC member or system of care coordinators participating on the grants committee. So another great place to learn about what your other colleagues are doing around the state. And then finally, yep, these learning collaboratives, the dates are there. You should have these appointments on your calendar. And we'll talk a little bit later about what you want to do in the space. And then just a few other things. If you haven't yet already, let us know who your sub-grantees are. Please let me know. Just via email, we keep track of that. New this year, just wanted to call this out in the grant agreement language, is that you can move up to 10% of your award, so $20,000 to a new funding category without letting us know. If it's going to be more than 10%, then just email me, and if we have any concerns, we can talk about it, but we probably won't. The exception here is that any limits on those indirect expenses still apply. So you can't move $20,000 to your indirect, for example, if unless you've already, if you haven't done that yet. Any questions about that? And then, yeah, you know me, where to find me. And grants committee meeting last Monday of the month, 11 to noon. Happy to add you to that appointment if you want to check it out, or just get the meeting minutes and agendas. It's a great space. And if you have feelings or ideas about the next round of funding for 25-27, that work will start very, very soon, so that we can try and get ahead of the delay and get these grants out the door even sooner. So would love your ideas and wisdom on how to do that. And that's where that conversation will take place. Anna.
Thanks, Christy. I just also wanted to say that after so many conversations about how do we do bringing in more awareness of the state level system of care members to what's happening in the local region, we're trying to bring in more local system coordinators to come speak to what they're doing with their grant and how they're using it and what they've learned through this process. So we had Bridget Wheeler from Coquille Tribe come to the last full council meeting, and I think Pamela is on deck for this May full council meeting. So if any of the rest of you are interested in that, no pressure, right? It's like one more thing to prepare for and one more thing to have, one more meeting to go to, and also hopefully it's facilitating some sort of bi-directional communication about like how are we connected and what are we doing together, and what is the impact of your work on our work and vice versa. So just wanted to put that out there for you. Those meetings are the first Tuesday of every month, and they're forever long. They're 12:30 to 4:30, but we typically try to have the system of care coordinator come towards the beginning for like 15 minutes. So if that's something of interest, you can email me and I would be very happy to have you come join us. Thanks, Chris. It's a big chunk of meeting. You would not be the only person catching up on emails during that time while they're also in the meeting.
I would love to be there. Literally, it's just been I'm like, once I can get everybody on the ground doing what we're supposed to be doing, then I'm like, okay, I can start handing things off.
Yeah.
Soon.
It is a long meeting, but if do you get the public meeting announcements? You can sign up to get the public meeting announcement, and that's just a nice way to be like, oh, this 4-hour agenda, like I actually do want to listen to that 30-minute piece, and I think we do a good job of kind of staying on track with the time. So
for the most part.
Yeah, my theory isn't that, like, I think it's a good meeting. I want one of my team members to be present at it. It's just been trying to get everybody's ducks in the same pond so that we can do that.
We're not requiring rows.
No rows.
hey, Pamela.
I just wanted to comment on Anna's invite and just some feedback from those that are part of the grant awardees, and they are just thrilled and excited to be able to join you and report out on the great work that they're doing. So very much appreciated, and it's been shared with our different committees that they're going to be speaking at the state level. So a lot of excitement on our end and in getting the opportunities. Thank you.
I'm excited about it too. And Pamela, if you want to meet before that, just to prep for it or have any questions, I'm really happy to do that.
Okay, thank you so much.
Yeah.
Okay. Any other questions about the grants? Selby, I see your point here about agile funding. Yes, let's put a little pin in that because I'm wondering if that's something we want to bring to a future collaborative to dig into.
Do you guys plan on doing any sort of report out on this agile funds, like how they were utilized across the state?
Yeah, if that would be helpful to you, I do have a drafty report that I was hoping to get out to you. And now that I have the final data, I can definitely do that. Is that something that would be helpful?
We just noticed in our region, so much of it was needed for food and basic needs, and people were really hoping to get, more enrichment, and activities for family and kind of those supportive factors. And it really just went to basic needs. And for, I mean, it's good that that's helping, but it was kind of surprising, not surprising, but surprising at the same time, just to see that in the data.
Yeah, for sure. I mean, across the board, the vast majority, and I could get, the percentages and actual numbers here, but like the vast majority of those funds went to housing supports. So it definitely raises questions for me about like, there is a housing crisis everywhere. There's definite need. There's also a lot of resources, not enough clearly, but there are other resources that are available in communities. And I'm also really thinking here about the new health related service needs, particularly the housing benefit that will get started, I think, later this year, right? And so I think it would be great if we could use one of these collaboratives to kind of, I could prepare that data for you about what happened in the 21 to 23 grants, and then maybe we could have some kind of conversation about, the other funding sources, the barriers. We could get somebody from OHA's health related service team to come in and kind of talk a little bit about, what those new housing benefits are going to look like, and you could all feedback about how it's really going or how it's working. Anyways, I'm just throwing out ideas, but would that be beneficial?
Yeah.
Okay. Chris.
I want to just say that the interesting thing is we are going into. We facilitated the entire agile funding the last time, and so this time we are facilitating it, but we are getting more feedback from like community partners. And what I am finding in the feedback from community partners is it's such a little amount of money, and they still want to have like this, nobody should double dip, nobody should do like all these, and it's not families and youth, it is community partners saying, well, all of these categories, there's other places they can get that money. And I want to make sure that they're not double dipping. And I want to make sure that they're not. And so the amount of gatekeeping, and I'm going to use the word gatekeeping, that's really what they're trying to do, is to prevent. And I'm like, it is literally no more than $400 per family. Like, what do you think they're doing with $400 when they're asking for, like, so what if they're asking for $400 worth of food? Like, so what if they're asking for $400 worth of housing supports? Like, that's sort of what is coming up in going into this agile funding. Just interesting to me, like, just curious as to what you guys are seeing around that.
I definitely haven't seen that as much. I know that like the funds went super fast. I think what challenge I've experienced is just that people really wanting to find ways to like use it effectively or make it stretch or like help like target like the most in need families. And, I think those are all, very good ideas and goals, but it is just so hard to have the level of impact that I think folks want to have with this small of amount of funds. You know, it's just, it just doesn't go very far, you know.
Yeah. And hi, Amelia. Thank you for joining us. I don't know if other people know you, but Amelia's with the North Coast System of Care. Do you want to?
Yeah. Hi, everybody. I'm sorry that I was running late. I had a doctor's appointment run long, but yeah, I'm Amelia Kircher. I'm the executive director for the Amani Center, Child Abuse Assessment Center in Columbia County. And I participate with the North Coast System of Care and the regional group and everything, but excited to be here and join y'all.
Yeah, thank you. Yeah, the North Coast System of Care and CPCCO invited the Amani Center to apply. So they're the grantee for that region this year. Hi, Selby.
Hi. So I have two thoughts. One was the local CEO of NAMI Multnomah. I heard her comment before that, like, whatever the legislature or foundations, you know, will put all kinds of money to all different projects, but that if you propose giving money to families, then they're like all over it. Like, what are those families doing with that money? You know, and so I think there is that attitude, but I'll also say, like Chris, we were kind of middle ground. I never heard anyone here use the term double dipping, but I know that we did have that phrase though in our kind of rules we laid out for ourselves about the resource shouldn't be accessible from another source. And so we did give out gift cards for food and clothes and sometimes utility support. But if we could, we also supplied, you know, the referent with information about here's the local PG&E assistance program. So I'm sitting with the word you use, gatekeeping, and I'm trying to see how I feel about it. But so I feel like we did fund those sometimes, but if we knew that there was support somewhere else or that it was really a Medicaid flex funding request that could be fulfilled or different things, we did sometimes try to work through other channels. I'll also make this kind of interesting observation that in 2 of my 3 counties, I'm working through specific ODHS child welfare preventative staffing groups. And so their population of focus is a little bit more directed towards families that child welfare is on the assessing, right? And they want to try and keep them from having to open a formal case and the child be removed from home. In Multnomah County, their program functioned differently. And so the range and diversity of requests from Multnomah County was very different. And again, Multnomah County, as you know, should have a lot of resources. And that's where we really had to kind of pause and be like, okay, well, have you checked your local food bank, and have you checked this resource or these company, you know, these other companies for this thing? So in Multnomah in particular, I felt like there was more of this kind of give and take between we want to support families and we did fund those items, but there were times we said, please check this other source. And we still want to do agile funding, but can we support a different way? So, but anyway, I will keep thinking about what you said. But yeah, I think in Multnomah County, we're trying to strike a balance there.
I like that, Selby. And what I was going to share is that on our ask, we asked, where have you tried to get this need met? So we kind of could start to gather where people are looking and where we could
do too.
Information. And so nobody, like, there was no questions like last time. Like, we created the form, everybody said, yeah, we're great at that. And it isn't everybody that's really, it's just an interesting, I never had anybody really question it in the past. And then now that like, we're like, here, this is what we're doing, then we have, and it's funny because the people asking those questions and using those words, double dipping and things like that, they work for DHS. So these are, you know, DHS individuals who are like, you know, saying, well, we want to make sure, and I get that we're trying to help all those things. It was just an interesting, going into this agile funding ask. During the last time when we brought it before the team and said, this is what we're doing, and the youth and family had said, this is what we'd like to do. Everybody was like, oh yeah, that's great. We love it. It's just this time they're questioning, and it's just not a ton of money. So, and I haven't been at the practice level work groups to really engage, to be like, hey, tell me more about that. Like, what are you seeing, or what are you know, that kind of thing. So that's what we're going to go into doing. But
Like, is that a response to something that they observed in the last round? Is that kind of what where your curiosity is, Chris? Of like, is
Yeah,
this
like
coming
what
from somewhere that's like
yeah,
based in
yeah.
observation, or is it just based in fear?
Yeah, and that's kind of where, because I don't know when we're talking about like housing, what we spent the money on was like we paid $400 towards somebody's back rent. It didn't pay maybe for all of the rent except in Lake County where it paid a spot for their travel trailer. You know, that kind of thing. So it wasn't, yeah, I'm curious, and so now I'm gonna have to go back and like just make contact and be like, hey, tell me more about that, and be very curious around where they're seeing that, because when I'm looking at that county and how it was used, families were asking for like heaters, and families were asking for, so when we're talking about what people are asking for, they were asking for heaters and food, and we all know food stamps are wonderful, like they're amazing, but sometimes they don't fit. They, you know, families don't get to eat all the way to the end of the month. They are struggling with that. And so I intend to go back and really have that curious questioning around it. It was just interesting that that wasn't something brought up. And then now I've heard it in 2 different counties, like where it's like, oh, and it's DHS child welfare that is asking. And I'm like, and nothing on there is really things that child welfare temp lodging would necessarily pay for. I guess maybe that's the thing around that.
That's really interesting. I wonder if there has been some conversation in the DHS space about funding stream with their like family first preservation funds that they're trying to spend in a new way. Like if there's sort of heightened attention to managing funding streams in a specific way or something. I mean, it feels like the opposite of what they're trying to do, but
yeah. So I figured I'd just go and have conversations with those communities, their child welfare, and be like, hey, like let me, and then I'll bring the graph of like how things were spent, because in one of those counties, most of the money was spent probably to fix vehicles and things that aren't necessarily
which is exactly like fix that emergent need so you don't end up in crisis.
Yeah. So yeah, so
I'll be interested to hear how your research goes.
Yeah, no, I'll take all the graphs and have the conversations. It just was something that was curious, as prior a year ago, everybody's like, yeah, we love, you know, nobody had any questions. And then this year, child welfare is really using the words double like that, you know, they're not, I'm like, it's so little money, but are we really harming people by allowing them to have? And I guess that's where my heart comes from. Are we harming anybody by letting them have a little extra?
Yeah.
So.
Okay, I'm hearing a lot of interesting conversations. So I'm just gonna make a decision that we will take all of July's collaborative just to dig into the Agile funding. I will get that report together. Chris, you're gonna come back and report out some interesting information from your friends. Yeah, so let's just plan on that. But I do want to talk about other things, because there's a lot of other really great work happening in those grants. So I don't know, I did put together a summary, and I will bring that up, of all of the various things that are happening in those grants. So this is the document and the appointment 23 to 25 system of care summary. So all of the regions who got granted funding, y'all got $200,000. You can see everyone, youth and family DEI. Those were required funding categories. Barrier resolution, barrier identification, a lot of most people allocating to that category. Interestingly, only about half of the grantees are using these grants for Agile funding. So something to consider when we talk about that next month or in July. A lot of support to your collaboratives. About a third of folks funding communication related work. Nobody doing anything around strategic planning. And about half of folks taking some of that money for indirect costs. On the next page here, you can see a little bit of a breakout in terms of the percentage of allocation across the grants. and where the funding is going. And then just kind of a high level overview of the types of things that people are doing in those given categories. So we can look that over. And then if you really want to know the details, I carried your activities and your allocation for each of the grants, and including any sub-grantees that you have identified. So, and this is available for everybody. So if you see an error, or if you've added a new grantee or something, you got a question about what I transferred over for your grant, please let me know. But I really would love to hear from all of you. And we've got a small enough group, so I think we can just keep it all in the same room if that works, and give you all just, a few minutes, maybe 4 minutes a piece to share out. I've got 3 questions for you. I want to know, shared a little bit, like high level, your planned activities, kind of what are you allocating to in your grant? And then what's one thing you're super excited about? What's one thing you might be a little worried about? And if there's any specific area or activity where you are looking for a little bit of support, from SOCAC, from each other. So I will put those questions in the chat, and then would ask who would like to get us started.
I can go.
Thanks,
Lana. So I am also here representing Jackson County because Tracy's had a spring conference thing. So Jackson, and then Josephine, and then Pamela can help me with Curry. This year was sort of like just building upon last year. I don't think we made like any huge strategic changes. We chose to fund programs, things in our communities that were working well and we're getting a lot of momentum. Like in Josephine County, we have a lot of partners working on early childhood, and there's some really fantastic work happening. Our system of care really isn't focusing too much on that, other than just really cross-pollinating and supporting each other. But they had some funding gaps for 2 years in really pushing some of that work. So we were able to come in and help with that. And so we sort of continued that by we helped with this kind of family center last year, where we're really investing in getting parent voice for system of care in that space. And they're branching out to the rural areas and kind of having these pop-up early childhood resource centers. And there's all kinds of fun groups for the littles and the parents. They're really building a strong support and sense of community, and they're able to kind of expand that into our more rural parts. So that's really exciting. And we've been able to really use those parents and families for a system of care as well, for that family voice. And in another one of the projects that they're working on that had some funding gaps was really supporting the early childhood staff in building up their skills around these behaviors and emotional issues that they're seeing with little preschoolers. And the staff, they did a whole survey for early learning preschool staff, and like they're really burnt out, and they're seeing like all these things that they've never seen before. And a lot of them that workforce is already, challenged enough, and there's many of them with one foot out the door already. And so anyways, there was some gaps there. A lot of the grants they were going for weren't covering this program of helping the staff increase their behavioral health knowledge and skills. So we were able to come in and support that. So those are really exciting, just to help build up that momentum in our community and make sure everyone is we're all focused on that, really, and it's been powerful. We didn't do agile funds just because there were a lot of areas that people prioritized. Building youth and family, I talked about the family. Youth were working with Boys and Girls Club in Josephine County, because we don't have like Youth Era or any of those, and it's going really well. So we just kind of continued that. One thing, and then in Jackson, we already did the kind of strategic plan, and so it was helping some of those work groups and the work, like investing in the work to help it continue to grow. There is one project that's a little bit, I know the SOCAC kind of had a lot of questions about it. And so I'm worried, we're a little concerned about that. It's Chest Health. It's an app that one of the work groups, critical shift work groups, is piloting, and so I don't have to go into all that, but can if people are interested. And I don't know where my areas of support are, and I think I just keep rambling. Is that even what you were looking for? That's the bad part of going first.
Yeah, no, that's great, Lena. Thank you so much. And super, super excited to hear about that early childhood space and the momentum that's picking up there. And Danny, I don't know if you saw my chat. I just was hearing that maybe some of that work might be relevant to the barrier that you all submitted about early childhood concerns. Hi, Pamela.
I'll go next. So in Curry, we were sharing a lot of the Curry County between L-Care and Advanced Health, and we're looking forward to building the youth program and the family program in Curry County with some of the funding, and continuing with our South Coast Early Learning Hub with the parent cafes in both Coos and Curry County, which has dovetailed into a parent advisory committee. Very proud and excited about that and the momentum that's occurring with that particular funding stream. They continue to fund the program, and we just support it with the child care and the stipends in that particular program. So that's helping expand our parent involvement and listening groups that help inform the work that we're doing both in Coos and Curry County. We're also in the IDD section. There is a new grant awardee in Curry County that is providing childcare for autistic children, and is looking forward already. She just opened and looking forward to expanding. So we're really excited about being able to provide that much needed service in childcare for autistic children, and then we're also going to be doing a poverty simulation, both in Coos and Curry County, with some of the funding for our DEI commitment. We're doing again another supporting a health fair in both Coos and Curry County, partnering with the CAC committee in Curry County, and partnering with public health in Coos County this year. Scholarship funding for the LGBTQIA funds are also going forward. Foster care, resource families, respite care is also agile funding both in Coos and Curry County. Coos Hispanic Allies still seeing insurance gaps there. So we're moving forward with that. And they are also getting a portion of the Agile funding specific to the Hispanic Latinx population. So worried about not as much this year. Things seem to be in place. The Agile funding, recipients, they're have gone through a learning curve, and so it's just really fine tuning at this point in time, moving forward with similar funders because of the continued need through the barriers that come forth through our committees and in addressing specific populations. So I think both Coos and Curry County did a phenomenal job in really bringing in all the voices to wrap into our grant fund proposal. So thank you to the committee members for the approval and moving forward with the great work that we are tasked to do, and just really appreciate having this opportunity to bring funds to the families that who really need it. And so thank you so much.
Thanks, Pamela. Did you ever get in touch with somebody from the Community Partner Outreach Program about health insurance? Do you remember this?
I don't recall. I have to circle back.
This was around like your funding for the Coos Hispanic Allies. And I was just curious about the, OHA has a whole community partner outreach team that's stood up really around getting Latinx Spanish speaking folks, in particular undocumented folks, enrolled in Medicaid with the Healthier Oregon expansion.
Oh, okay. Now I'm remembering. Yeah, I actually reached out to somebody at ODHS who took that task on to partner with the Coos Hispanic Allies. So they are moving forward with that educational program, since they have that in place. They have a local van that's going out rurally. So they're working together. Thank you for that. And yeah, and Coos Drop Youth Era is a new partner with our youth advisory committee, and really looking forward how we can expand that in Curry County. So, and other fundies. I didn't include them all.
Yeah, great, awesome. And Amelia, yeah, I see your question. Yes, for sure. There's a whole network of community outreach folks out there who are really there specifically to get people enrolled in the Healthier Oregon program, which is health insurance for people without documentation.
Yeah, I think that would be really cool with our project, and like also just even just to be able to have a conversation with them around like what's been effective, and how are they doing that outreach would be really helpful.
Yeah, for sure. I will drop this. And then for folks who are above the OHP eligibility, the 130%, the Oregon I can't remember the name of the agency. Anyways, a big report just came out about folks who are eligible and enrolling in the marketplace and the financial supports. And so there's another effort, not an OHA, but there's another effort for people who aren't eligible for Medicaid, but otherwise have some financial barriers to buying insurance through the marketplace. So I will find that for you too. Okay, who would like to go next?
I can go. Oh, go ahead.
It's okay, man. Go ahead.
Are you sure, Danny? Okay. I apologize for being off camera today, folks. I have a terrible headache and I am not camera ready. I know some of us have those days, so I appreciate your patience with my black screen. So I just wanted to pipe up, most of you know this, but our grant work was done before I was moved over to system of care for YCCO. So I'm inheriting decisions that were made before I kind of moved over to this. And I'm still kind of wrapping my head around what the intention was and the background. And you know, what folks were hoping for moving forward. But I did want to say, Christy, in looking briefly at that grant summary you showed, I don't think YAMHEL was marked for Agile funding. And it was my understanding that we were doing Agile funding. But I haven't seen all of the grants that you're sending for signatures going back and forth are going above my head. So I haven't seen anything. It hasn't been forwarded to me yet by my staff. So if there were changes, then I'm not aware of them yet, I guess is what I should say.
Yeah, that might have just been my mistake, which is why I
Okay.
looked at it. So I'll
Yeah,
make
yeah.
note.
Because I think the
Oh, the majority.
Yeah.
Yeah.
Our committee was really impressed by the impact that Agile funding had in our little rural community the last time around, and was really invested in maintaining that moving forward. Again, the other piece that I'm picking up from context clues, jumping on these committees after all these decisions are already made, is that one of our big community partners, Yamhill Community Action Partnership, YCAP, has been doing a really intensive community needs assessment that wasn't going to be finished before the grant was due. And our committees are really invested in looking at that needs assessment and pulling out, identifying gaps, looking at barriers. But because it wasn't going to be ready yet, we really invested in keeping that funding flexible in the Agile funding category, knowing that this summer we're going to be identifying some things from that needs assessment that will likely want to funnel funding towards. Ooh, excuse me, my words today. So we're really excited to look at that. It was really intensive. Our current co-chair is a YCAP employee, so they're a strongly invested community partner with us. And I think she said they did over 20 listening sessions with community family members. And, you know, I'm really excited to see what's going to come out of that and how we can use the funding from our grant flexibly to maybe identify some of those barriers that come up from that needs assessment. So that's what I'm really excited about. I'm nervous about everything because this is my first time. So that's an easy easy answer to the question. And I think also inheriting and maybe being given custody over something that someone else worked really hard on and invested in, and you know, wanting to make sure that I'm doing a good job of carrying that intention forward. I'm nervous about that as well. I'll need lots of support. I'm really grateful for this group. My fellow coordinators have been so welcoming and supportive, and it's been great to connect with them and their patience with my really simple questions that everybody probably already knows the answer to, but because I'm the newbie, I'm always asking them. So grateful. Obviously, our community, just like everyone else has said, is so grateful for this funding. It means so much to our committee members in our community to be able to do this work. And yeah, and so lots of gratitude from me as well. I hope that was decent, Christy.
Great. Thanks, Amanda. Yeah, I'm curious. So the needs assessment is coming out of the Community Action Agency. And I'm just wondering how, if that is leveraging or connected to the community health assessment that YCCO puts out.
That's an excellent question. I think they were separately conducted, but obviously we communicate with each other really regularly as agencies because we're really close partners. So we're definitely going to be, my understanding is that we'll be sharing that data with each other. And certainly I think what each group has collected will help inform and create more robust sets of data for everybody. Does that make sense? Yeah. And the chip and all of those pieces are things that I'm distantly connected to within our structure, so, and still very new to as well, but you know, I'm excited for the potential, and I think there's room for that to be a huge part of our work.
Yes, any of that alignment work Makes my heart happy. So
yeah, for sure. Emily Johnson is one of the big contributors in the YCCO space for those pieces. And I mean, she's been with YCCO for probably almost a decade. I mean, she's so knowledgeable and excellent and really open to collaboration. So that pathway is very open for us internally at YCCO between me and her. So that's really good. She's excellent.
great. Thanks, Amanda. All right. We got 5 more regions left. Who would like to go next?
I don't mind going.
Thanks, Amelia.
Yeah. So our project is kind of unique. I think that we didn't quite know what we were getting ourselves into, maybe. So I am not like, the regional system of care coordinator or group or anything. We're an independent nonprofit organization, and our system of care had encouraged community-based organizations to apply for these funds. And so our project is somewhat rooted in our work as a child advocacy center, but it is aimed at benefiting the entire system of care. So as a child advocacy center, we help families and particularly child victims with navigating systems of care and navigating our criminal justice system and all of those things. And so we have, long been kind of a hub for different pieces of our system of care in our community. And so the work that we do is kind of inherently tied to all of that. Our project is aimed at outreach specifically to our Latinx and Spanish speaking populations in our community. We have spent a number of years doing research around kind of the number of referrals that we're seeing, other service providers and their responsiveness to our Latinx community members and Spanish speaking populations, and really noticing that there's some pretty significant gaps there. And so we partnered with the Child Advocacy Center in Astoria and in Tillamook to put together this project where we're going to be bringing on a Spanish-speaking victim advocate community health worker in each community that can do some of that outreach work and really help families navigate systems and help them engage more with our system of care. And hopefully, get folks connected more with, child abuse prevention activities, or, knowing that the service is available for them in Spanish if needed, but also, beyond that, just addressing all those kind of social determinant of health aspects for families. Like, even if you don't need a child abuse assessment center, you might need mental health, or you might need housing support or food support, or, all of those other pieces. And these victim advocate community health workers can really do that support piece. And it also includes some consultation to help us figure out how to do better and what we need to do to conduct effective outreach. So I think my biggest worry in all of this is just that this is my first time coordinating across 3 different counties. And then that outreach is hard. It's hard for everybody to figure out how to reach the people that we truly want to serve, regardless of what their demographic categories are. And so I'm nervous about my ability to be effective in this work, but I think there's a lot of support, and I think that's would be the support that I would ask for, is that if anybody's had, you know, successful partnerships or outreach with Spanish speaking or Latinx populations, any pitfalls or pro tips or anything like that, we'd be really grateful for it. And then I'm really excited about the impact. I'm excited about the Tri-County collaboration. I'm excited about, you know, what our system of care, what all this is going to look like, you know, a year from now, 2 years from now, from the impact of this work. You know, my agency, we've already started some of this work on our own, and just our organization and the way we've changed, you know, because of that, those efforts, it's really exciting. Like, I have 3 Spanish speaking staff now. And when I started, we had 0. So, you know, it's pretty cool. Yeah.
So cool, Amelia. Thank you so much.
Thanks.
Super excited to watch what happens here with this investment. And you are in very good company. I think, with the exception of Amanda, all of these coordinators work across multiple counties. Chris Barnes wins the prize on that with Eastern Oregon. So lots of pro tips in this room related to providing outreach in a really broad area. I have to say, I got invited to just do kind of a system of care 101 at the Family Advocates Collaborative that Oregon Child Abuse, oh boy, okay.
Yep, Oregon Child Abuse Solutions.
Yeah.
It's a
Yeah.
statewide network
Yeah.
of child abuse intervention centers.
Yeah. So I was hanging out with some of the family advocates on Wednesday, and I mentioned that that you all were a grantee with these funds, and that I think people were excited to hear about.
That's
So
awesome. Yeah, I'm really excited that you presented at that group, because I think across the state with our CACs like this, I don't know that they understand system of care in the same way. And like, I kind of fell into it, right? Like, as a community partner organization, nobody came to me and said, this is what system of care is, and this is why you should get involved or care. It was like, I was part of our RAP committee, and then Gobi, who had been running the RAP program in Columbia County, also ran the system of care work groups. And it was kind of like sideways falling into it from this RAP committee. And then, you know, we've had a staff member on our local committee, and then I'm now on the regional committee. And, you know, it's just, it's been really interesting to get involved and like connect in that way. And I think a lot of centers in smaller areas, like, they're trying to build these connections on their own, you know, at this base level. And it's like, there's this group, you guys, there's a system of care group that, like, you know, can help with that and connect everybody. And I'm excited for more centers to get that information and know. But I just encourage everybody in here that is a system of care, you know, person to you know, reach out to your local CACs, because they care about this work. They're trying to support this work, but sometimes we're doing it in a way that's disconnected, because they just don't know really. Like, you know, there's this group that exists, and they know the acronym, but they don't know like the work and the impact necessarily.
Yeah, when before I started, I asked the people, like, who knows about system of care, who like participated, engaged, and like only 2 people raised their hand. So ripe opportunity for partnership there for sure. Okay, super excited about that. Who would like to go next? Hi, Danny.
Heyo. I'll just try to make it quick, because I know we got a few more people to go, but it's exciting to hear the work that everybody's doing and how it looks so different in all the different regions. I mean, we all know that that's the case, but actually getting to meet and talk about it's kind of cool. in Central Oregon, we're seeing nothing but growth right now, and it's so exciting. I mean, we're expanding our drop-in centers. Crook County is really wrapping around the one that we have. We initially were going to use our grant to create a startup for a new youth center. And through some research, we discovered one that like most people didn't know about that's very well established here and is serving up to 30 kids at a time, which in Prineville that's a lot of kids. And so what we're going to do is just kind of help them expand and just try to really support them. And we're also in kind of meeting with them and talking about their needs. We discovered that they need some QPR and some mental health first aid. So we're going to wrap around them and do that. So it's exciting. We had a health fair the other day, and in that health fair system, because myself and our wraparound coordinator were there, and we met 5 new community partners that want to join our system of care for Crook County. So I was like, oh, okay. So it's exciting. It seems like everywhere we go, we're growing right now, which I know won't be forever, but we're going to celebrate it while we can. The one thing I think I'm worried about is that our administrative behind the scenes process between the CCO and stuff, it takes forever to get our financial agreements signed and then get the money freed up to go to our CBO. And I mean, like months. And I'm really worried we're going to waste half of our grant cycle again waiting for that. And there's nothing more frustrating to me than knowing that we have money to help our kids and we can't touch it. So worried about that, hoping it gets better. I don't know that there's a way to expedite that, which is very frustrating. It is what it is. So yeah, I think that's it. What was the last thing? What was the last question? Oh, any support. I think that any support that we need, we have so many people that we can reach out to that I feel pretty good about that. Selby, QPR is question, persuade, and refer. Yeah, it's a suicide prevention model, and we are providing it to community partners. Myself and one of the, well, she's our suicide prevention specialist with the health department. We actually partner to provide those trainings. I got certified this last year. So it's kind of exciting. Yeah, Lines for Life will get you certified for free, which is pretty sweet. I don't know how long that offer is up, but it's been for the last year.
Great. Ride the wave, Danny. Super exciting. All right, we got Selby, Chris, and then Laura. We'd love to hear about Marion Polk because it's also like a super different use of funds, but I understand if you don't feel prepared to speak to the details today. So
yeah, I have a very, very high level understanding of it. I briefly went over it with Heather, so I can speak a little bit about it. I don't know if I'll be able to answer any questions though, but I can try. So for ours, we have and I'm just going to read this kind of, and it says, so for the youth and family engagement, we're building out, or we're creating a youth and family council. We currently do not have one, and we want to build that, and part of the funding is going to be used for that. That's kind of my position. I don't think I actually introduced what my position was, but I'm the community engagement coordinator at the Willamette Health Council, and I'll be doing a lot of that outreach and connections. So we've already started kind of compiling a list of different organizations that already have those youth and family like meeting spaces, and we kind of want to start doing some outreach and introducing what system of care is, and see who's interested to be a part of those committees or those councils. So that's kind of where we're at right now for one part of it. We're also, for the diversity, equity, inclusion, we're contracting with the belonging consultant, and they're going to assist to build out and expand our system of care structure. So right now at the trip that most of my team is at, they're with this contracting consultant, this belonging consultant, sorry. So they're learning a little bit over there, and we're going to be doing some work with them here. We're also going to be working with culturally specific CBOs within the Marion and Polk communities to kind of build all of that. And there's one other thing, and this I'm not very familiar about, so this one I will read. It says, develop the new system of care structure map, which outlines the system of care spaces, build and implement our new system of care structure. I think recently we did the strategic plan, and that's kind of part of the work that we're going to be doing. So those are like very high level. Like I said, I have a very, very basic understanding. I started with the council like in January, so I'm still learning a little bit as I go.
That's great. Thank you so much, Laura. And now we were at lunch together, weren't we?
Where you
Maybe
started in January?
Yes.
Oh, then yes.
No, I remember. Yeah, thanks so much. Super excited. And for other coordinators, like Marion Apolka is like a super different model, like all of it going to infrastructure. So really interesting work to watch in that region. Okay. I think we're just down to Selby or Chris.
I can jump in, beat you, Chris. Well, 75% of our money to agile funding, so that's easy. So yeah, just some kind of interesting work going on there about how they want to move forward in their second year. And in particular, the Multnomah County model, as I mentioned earlier, is just so much in flux and changing. And if our ODHS partners are successful in bringing in some of those preservation funds, like for that county, they're going to have a paid staff person to support the work, and they're going to like double their budget, more than double it. So we'll see how that turns out. So it's kind of interesting. Like I said, I have these really kind of more very specific models in Washington and Clackamas, and then Multnomah, as perhaps should be expected, is kind of doing its own thing. The only worry I have about is really just my personal one of capacity, that because of our consulting process last year, I now have some strategic plans we need to implement and lift up this year. And so I'm worried about my own capacity, because the other part of the grant that's not going to agile funding is going to some projects that I have to like provide the boost to get them started. So and those other projects are, one is we wanted to have another community engagement intern, which is what we had. We had one last year that was real valuable. So continue that work. But again, like I'm kind of stuck. I'm still jumping through the hoops I need to get the intern hired. So that's that capacity issue. And then we also are gonna, again, the last intern we had did kind of a modified photo voice project with youth at the Clackamas drop. And as a result of that experience, the youth chose to, they wanted to build quiet rooms in area high schools where they can go to regulate their mental health. And so that's the other project we're doing this time around. So again, I think it'll be cool, but have to kind of get the intern in place to help support that work, get whatever partners I need engaged, and start that youth whatever quiet room project. And so that's kind of where my capacity worries are, is just needing to make that happen while I'm trying to also be true to the plans that we spent a lot of time and money on creating last year. In terms of support, I couldn't really think of anything that I need specifically, like from SOCAC staff, and in terms of supporting this work. I guess maybe some light support is that Anna and Christy, you've both been great sometimes about letting us know about local community agencies. And again, the historic problem is capacity to reach out and network with those agencies, but more community networking is a huge component of both our new community engagement and equity action plan, a huge component of our new barrier processes that we designed. And obviously it's a big component of our installation of quiet rooms project, because the way we designed that project is that we are actually networking with youth councils that exist in Tri-County area. And so anyway, if you have ideas about further connections you hear about in Tri-County region, as you've been doing, appreciate to continue hearing about those. Yeah, so that's kind of what we're looking at. So the agile funding, quiet room installation, and the intern. And then I had a little smidgen of money for operating funds for kind of stipends in specific situations or food at meetings. I'm really trying hard to run hybrid meetings. It's really hard to get people out of their virtual boxes, but I'm going to keep trying, and some things like that. So that's us.
Thanks, Selby. Super excited about the Quiet Room project. And there was just in our draft newsletter, there's a foundation in do you know what I'm talking about? And they were like announcing a launch of like a whole like Quiet Room. I'll see, it's in New Jersey, so I don't know how relevant it is, but I'll see what I can find for you, Selby. And yeah, as a Portland local, would love to attend a system of care meeting in person, especially if there's food. Let me know. All right, last but not least, Chris.
Yeah, so when you say what is one thing you're excited about, for me, it's probably doubling our Youth and Family Leadership Committee again. That's probably what, like, I love that happening. Some of our asks, we had a variety of different asks, and so some of it's youth and family engagement. We are going to provide this year mini grants to a couple of different either family and youth who want to create safe spaces or want to have get-togethers that currently there is no other way for that to happen, or for our BIPOC and LGBTQ IA2S plus community. We're going to do mini grants for them. And so the first mini grant that will probably be going out will be June, because Union County is having a Pride event, and they have had no funding to be able to do that. And so that's probably going to be our very first mini grant out, is so that they have the opportunity to put on that event and have some dollars behind it. We're doing a little bit of everything. A lot more than half of our money went to Agile funding, and some backstory to that, because we did get asked the question, but some backstory is I had 5 counties that said, we don't care what you do with the money as long as we don't have to do anything. And so we said, okay, Agile funding for your community it is. Because that seemed, for me, and the Youth and Family Committee, the Youth and Family Leadership Committee was behind it. But for me, I was like, what is going to be the easiest for me to get accomplished in this period of time that I now have 5 counties saying we don't care? And so they're going to get Agile funding. And so I'm super excited about that. I'm really excited. We're going to bust some local barriers. And so our local communities are doing some community barriers, and around lock boxes in one community, and then hygiene. It used to be a senior project in Wallowa County that they would do hygiene for both home and health hygiene. So personal hygiene and home hygiene. They collect, they do all kinds of fundraisers, and they didn't take that on this year. And so everybody in Wallowa County was like, we really like this. And so they're going to do some health or some personal hygiene and home hygiene for Wallowa County. And they're going to use their dollars to do that. And then what I'm worried about is just my brain capacity. That's kind of really all I ever worry about, is like, can I do it? Like, I'll take on the world if I think I can do it. I do have almost a full team now, and our youth, she is our youth system specialist, and she will be doing some engagement of youth, but also she is going to wrangle our barriers, and she comes on Monday. She comes on Monday. So we're going to do some great youth engagement, and we're going to do some, we're going to start to really, not only, it's just keeping track and then the follow through, like where barriers are, and so to wrangle those. So that's probably my biggest worry, is just getting, the capacity. And then as far as help and support, just I think we got it, but I will always reach out when I need it. So that's kind of oh, and swag. We're actually going to get swag this year. So that we're also excited about that. So if I want to say, what are my youth and families excited about? They're excited about swag. So.
Great. Yeah. Marion Polk passed out some really awesome System of Care socks at their conference last year. So if you got cool swag to show off, put it on the base camp.
The socks are a thing. I've seen at least 2 different systems of care. I mean, how cute is that, right? You can't not get socks.
Pretty cute. Okay. Super exciting work. Thank you all so much for sharing. We've got 9 minutes left, so I would love.
Christy, you just randomly got muted in the middle of your talking?
I muted myself, yeah. With the time we have left, I'd love to hear your ideas on what you would like to do in this space. So I definitely heard a lot of interest in Agile funding, so we will definitely plan on that for July. But for future collaboratives, what would you like to do here? Were there projects you heard a little bit about today that you want to know more about? Are there themes that you heard and people's worries that you'd like to bring to this space? What would you like to do here besides talk about Agile funding?
Maybe one thing, kind of just building to the future, it might be more relevant to the next grant. I'm not sure, but just I actually did like in the previous round where we had to get matching funding, because that kind of really forced a conversation at the executive level that's been hard to engage in, for me anyway. And I really appreciated like being able to message around this idea of giving funding to our efforts and collaborative funding. And I think I've mentioned in other settings how I'm trying to work on getting kind of written into everybody's budget cycle every year. And again, that's a capacity issue. It's been hard to uplift that idea, but just as we move forward with our current projects and even for the future, like how can we get our system of care members to support our efforts? Because I'm sure all of our efforts would benefit from either additional funding or more funding in the future when this grant runs out. And even though we've already received these grants, I mean, there's new budget cycles. These are like 2-year grants, right? So there's new budget cycles for our partners coming up again where they could invest in the second year of the current projects you're trying to implement. But and again, so the capacity issue is kind of perpetual and hard to work around, but still just support about like getting people to give financially, maybe anyway, continuing discussions around collaborative budget. And I want to be real specific. I feel like sometimes when we talk about collaborative budgeting and funding system of care, it's really high level. And I've seen the primer and it's like, bring in the Medicaid funding and bring in the child prevention funding, or, bring in like all these kind of high level things and work on differentiating your tax base and stuff. And that just feels like so like far away for me right now. But if I got the locals to, even my local partners to even just be like we did the previous round, like everybody's gonna chip in. If they all gave me $5,000, I'd have another, $50,000. And so just kind of, again, working how to have conversations at the executive level about money. It's hard to be comfortable as a coordinator to ask for it. I know that even it was several years ago, but I just felt like even my executive council chairs were really like tiptoeing around the issue and bringing it to the executive council and stuff. So I think there's a lot of committee dynamics to be overcome to really talk about that, because normally the response is just we don't have the money. But when we were really pushed, like we could get $25,000 if we raise matching funds, I mean, people found the money. So
yeah, that's great, Selby. Thank you. I know we did not, the committee advised not to require a match based on feedback that people found it to be administratively burdensome. The kind of a consolation to that is in your application, we asked you identified where you had in-kind funding. right? So we could kind of go back and use that as kind of a launching for like, braided funding, collaborative funding structures. So
Yeah.
really appreciate
No,
this.
yeah, I understand. And it was administratively burdened. And just the last footnote I'll put on that is I think too, like to engage partners other than the CCO, like that's a very different conversation. So I think for me, a collaborative budget, I'm really trying like to not ask to draw my members' reliance off of the CCO. Because my first several years here, it was just always like, well, can't the CCO do it? Can't the CCO pay for it? Can't the CCO do it? And I remember one day where I said, health share is not the system of care, you are. And at the time after I said that, I thought, oh my God, what did I just say to these people? But no, I luckily didn't seem to get burned for it. But yeah, so to engage partners other than the CCO around a need to fund this.
That's great. Thanks, Elmi. Chris.
I was just gonna say that so when we meet, when we're at our executive, we're talking like DHS and, all of those. I get the impression that their budgets, even at our executive council level, their budgets come down to them from much higher, and that they don't have the wiggle room in changing when you're talking about big system partners, right? Like child welfare, juvenile justice. So they can do some things, but they can't seem to do other things. And so I just wonder if that isn't something that SOCAC needs to address, as far as like when you guys are making it, like there should be in their budget when Oregon, like when DHS meets, or when juvenile justice, that when Oregon Youth Authority gets together, that they put extra dollars into their budget, or they say these dollars are going to be designated towards systems of care. Because when we talk about, I mean, we can get some money, but they do not have the kind of dollars necessary or the ability to make the decisions, maybe, when we're talking about that braided and blended funding. So I'm just wondering if that's higher up than what our executive, and then Selby, maybe you have a different, do you have the state director who does all the budgeting at your table? This is just a question.
No, I don't. And so like my child welfare partners would need to go a level higher, but they have some control over their local budgets. Right? They like Multnomah County Behavioral Health Division was able to give $8,000 matching funds to our grant last time. Like they have control over their local budgets, but also I'm learning like I think I've mentioned I did a survey of my members where I use the contract language of, do you have authority to make financial or policy decisions? And they could answer yes, no, depends what you ask me. And most of them said, depends what you ask me. So you're right, they may not have that authority there, but then I'm starting to message about your leadership. Like system of care is more than just you people around the table, it's your leadership as well. And so that's pushing that conversation as well.
Okay.
All right, Pamela. I'm gonna have to bounce at 10:30, but you all, and I just made you host, so you can all chat away. What?
I'll try and be real quick. Yeah, it's always that question, both Selby and Chris, of, do we have the right people at the table to be making these kinds of collaboration, blending, braiding funding. Recently, our executive committee kept pushing for residential updates and so forth. So I reached out to Anna, and very quickly she brought me together with several of the OHA representatives who could speak to residential and crisis care. And so as a result of that, we now have a presentation, and I'm going to be inviting both executive committees from Coos and Curry County to our meeting in May, who will be talking about residential care in our rural community, and hoping to begin discussions around how do we at the local level blend and braid funds effectively for this crisis situation that we currently have. So I am really excited, and I have to tell you, I kept feeling like I keep getting these questions and I'm not the best person to answer them. And I think we've addressed this previously. We are not the experts in all areas. We can listen, but we don't have the hands-on, what's happening. We can report it out, but we can't always respond to the questions. So I always lean to Anna or somebody from the system of care, and I get directed accordingly. And as a result, having a wonderful conversation with Chelsea, looking forward to future in-person meetings with representatives from the state where they're going to bring the Department of Human Services and really kind of have that on the ground discussion. Coffee chat is what we talked about, with our executive members of how can we do this, and how what's the best path forward to address it. So really excited about that. Thank you, Anna, for all the support. And in May, I'll brief everybody on how it goes. It's the first of many meetings that are going to be taking place. And I have to tell you personally, I pushed back a little bit because I wasn't sure if I was ready for that as a it's like, what am I creating here? It's like, but once I made that decision, it's like, okay, this isn't all on me. The pressure is not on me to be doing this. It's really the system of care, Selby, like what you said, and redirecting that, and then getting the support from those who statewide who are doing the work and bringing the right people to the table on our behalf. So thank you very much. I'm going on vacation next week and I'm relieved to get this all put together. So yeah.
Pamela dropped the mic. All right. Have a great night, everybody. Thank you so much for sharing the space this morning. It really warmed my heart. I hope you all have a great weekend. We'll see you soon.
Thank
Bye, everyone.
you.
Bye.
Bye.